In addition, we also saw that mobile technology is going to be huge, and we also, you might know from who's been joining us on our survey tools and other things, we're doing a lot for mobile apps as well. And so Derek will be going through that with us and sharing some of the things we're working on and some things that are coming in the future.
I'm afraid my brain is so full from all that information, I may entirely forget my presentation. But let me start by asking this. How many of you have a smartphone? How many of you have a dumb phone, like a burner or a flip phone? One. So let's say that's, 20 to 1, 30 to 1. Why do you think that is? This is going to be interactive. Why do you think that is?
Marketing.
Marketing, budget.
Games. Value.
Okay, right. Value. Let's stop there. It's because I would offer it's easier to get along in today's world with a smartphone than without a smartphone. What are some words you would use to describe mobile technology? One word, shout them out.
Convenient. Personal.
Convenient. Personal. It's a plant. It's handy. They literally fit in your hand. What else? Something else? Immediate. Very timely. I like personal. You can focus. You don't have to go through the whole internet to find what you want. You can add to your phone those things that are interesting to you. I don't think we should underestimate the power of having something that can interrupt you in the middle of your work with an alert. This happened for me. I don't know, maybe this happened for you. Did you ever have a day when you sort of got email? You were like, I can write this message whenever I want. It's delivered immediately, and the recipient can read it whenever they're ready. And it's magical because something like that did not exist before. I think it's hard to see, maybe, because we're right at the foot of this mountain that is mobile technology, but I think it's the same kind of thing. Mobile technology is a game changer. I really like that mobile slide. I wasn't going to talk about this slide at all, but I really like that mobile slide that we started off with, where everybody's got a piece of mobile technology, which is what this poster is supposed to convey. It's the same person, it's the same mobile technology, but there's different roles, and it's impacting everybody. So I'm Derek Stone. I'm director of the Web Development Center. My group primarily does web hosting for the health system, but I have the great pleasure to work on this mobile program, which is something we didn't have the capability for. My initial charge was to develop a framework, which is a way to actually write apps, and that translates to, has translated into developing a strategy. Our vision for the mobile program is simple. Apps should be easier to use than not. Our strategy is also simple. We've got a two-pronged approach. We focus one set of our resources on our patients and our customers, and one set of resources on our team members. Incidentally, I've started the site apps.virginia.edu, which as I'm getting all this stuff, my act together, I'm writing it down and putting it here. It is a cooperative program. Everybody in the university, it's not just health system, everybody in the university worked together on this program because whether you realize it or not, mobile devices are owned by big companies, Apple and Google. So for a place like UVA to play in that space, it was not trivial. We've published our first app for the public, the Children's Hospital app. Who here has seen it? It's brochure plus. App wasn't meant for you anyways. But basically, it lets you do some checklists, like what to bring with your visit, and it tells you where the gift shop is and that type of thing. A major focus for my group has been doing all of our websites in what we call responsive, which means it's aware of the size of the device you're looking at it on and reshapes itself for a good experience. And I don't mind saying our Center of Excellence sites are fantastic on mobile devices. That's one of the things I'm going to show you if you come to the demo table. Has anybody, there hasn't been a huge fanfare about this, so I'm not going to be offended if you haven't. Has anybody seen the Children's Hospital website? Children's Hospital, Cancer Center, Heart Center, Neurology, Neurosciences is just about to go out. But they're all using a similar look. It's a new look, and it really looks good. MobiCog is something else I'm going to show you. This was done by computer science students. The reason I have it is because it's basically a pen and paper test done on a mobile device, but it takes advantage of some of the features of that platform. So, like you're supposed to remember a set of words. Well, with the app, you can write the word, type it, or speak it, and it says, oh yeah, that's right, or ooh, you need to talk to somebody. We were having conversations about the UVA Hospital app, whatever that's going to look like. Talking to my peers in this space, there are two things where we're getting a lot of value. And I say we, not us yet, but we will be us soon. One is in a care provider directory, and that value specifically is if I go to an outlying clinic, that physician can look the right UVA doc up and refer you from there. That's been a big win. We're going to do that, not this year since this year's almost over, but it's in the immediate future. Delivering patient education materials, that's also been a big win for other hospitals. We're going to look at it. I don't know how long it will take us to do it, but that's one I think is pretty cool. Wayfinding is a challenge, not just for us, but for lots of big places. I was talking to the guy from Boston Children's. They rushed right out and bought a nice package. They spent, I don't know, a little more than you would pay for the average home in Charlottesville. And the maps are not up to date, and people kind of make fun of it. So it wasn't good for them. So the idea is right, the execution we don't have. So here's another great example of that collaboration. We're working with the School of Architecture. They're doing some research projects around wayfinding. It's super cool. They've got the students dressed up wearing lead vests and having to walk long distances like they were actually patients. And then they're going to give us some suggestions. I think that is the greatest strength of an academic medical center. For everything else that we have to put up with working in such a big, varied place, we have a fantastic community and a lot of smart people. So some of those things I think we're going to do really well. To be sensitive to my time here. Okay. That is not nearly as exciting as what I'm about to tell you. That's the stuff for our public. The other stuff we do is for our team members, and that is stuff that helps us care for patients. This is super exciting for me. That poster that I started with, this, the reason I met that lady, she's a nurse that works on the 3rd floor, this was her idea. I had solicited from some of my nurse friends for ideas for starter apps. This is one of them. They're using it, and we're about to distribute it. We need to work on the mechanics of that because we haven't done it. But it's not an app that will go to the App Store. It will only be available to people here. It's a pump volume calculator. Basically, right now, for every 4 hours, who's familiar with ins and outs? About as many people as have flip phones. You put in the amount of drug that the pump tells you they've given. You put in the concentration the pump is set to, and this calculator tells you the volume of fluids, because you want your patients to be taking in and letting go a similar amount of fluid. You don't want to create an imbalance. So this is fairly simple. It's not trivial math, I would say, and nurses are doing it every 4 hours right now. So this could be a huge win for us. And I mean, I understand they don't always get it right every time. I probably won't. We are reviewing the market right now in terms of companies who offer communication solutions. So we get alerts from our mobile devices. Sometimes Facebook sends us stuff. Medical devices send us alerts. We can see alerts on Epic. There's all these ways we get bombarded with this stuff now because we can be alerted on stuff. And so some companies are working to consolidate that, and that's not going to be a trivial implementation, but that's going to be a great thing that mobile devices will do for us, I think. I don't want to take up too much time, but I saved the best for last. The medical egg timers. This is something I'm going to do, and I don't know quite how I'm going to get it done, but it's going to save lives. So I'm going to figure out how to do it. The idea came from physicians, the name came from me, but basically if you get diagnosed with something, for a lot of diagnoses, there is a specific set of things that guarantees your best outcome, best possible outcome. Let's say you come in with sepsis, and the protocol says after 1 hour you give antibiotics. The second hour you take their temperature. The third hour you get a lab back. Now put yourself in the position of a healthcare provider. You've got 10 patients, each with a different protocol. They all started at different times, and you have 1 billion alerts going off. We aren't very good. We have not historically been very good at managing all of these protocols. But remember, first of all, computers are pretty good at keeping track of things. And you now have something in your hand that can interrupt your work. So that's effectively the medical egg timer. I get a new patient, Nikki, she's got sepsis. I started at 3:35. Every time a new patient comes in, I can assign them, and my device will make sure I'm following the right protocol for them. Let me also, I'll skip over the docs thing. Let me mention also, at my table, I'll be sharing a table with the virtual desktop technology folks. That's something we're piloting also. That's basically, it's a lot of stuff. But it is your workspace moving with you for the sake of efficiency. It also can deliver other applications to your mobile devices and your desktop. It's pretty interesting, and I think we're going to have a live demo, right? Yeah, so check that out. Okay, at the demo, I'll show you the pump volume calculator, the MobiCog. You can see responsive centers, and then the virtual desktop guys will be right next to me. Any questions? This is the least curious group. I don't know if we've beaten you down into... Okay. No? All right. Next.